Our eyes, though small yet incredibly powerful, are the windows to the world. They allow us to perceive light, color, depth, and motion, giving shape to everything we see and experience. But what happens when that window begins to cloud over? The loss of sight is not just a physical change, it affects every aspect of life, from the loss of independence to the emotional and psychological toll.
We found that there is a gap in eye care services and generally the medical aspect.
Honestly speaking, I have seen the hand of God in every step of the way. In the light of course, the medical camp, the eye surgery.
Let's take a journey to discover how our sight connects us to the world.
So usually after the operation, the patient is expected the following day, after removing the bandage, the patient will be able to see.
This is the story of our eyesight health and the power of vision. Eyesight is a delicate and intricate system. Light enters through the cornea, passes through the pupil, and is focused by the lens onto the retina, where it is converted into electrical signals sent to the brain. This process happens in mere milliseconds, giving us the miracle of sight. In partnership with Lion Sight First Eye Hospital, Current Community SDA Trust, the Light Foundation and the Minasota SDA Conference, Vuna did an eye care clinic in the Transmara and Kisii regions.
What you're seeing in the background is an eye clinic. The people will come, they will have a screening where they're testing to see how their eyes are. Some of them will be scheduled for surgery actually right here.
While our vision seems effortless, maintaining a healthy eyesight is anything but simple. Age, genetics, and lifestyle can all affect our ability to see clearly.
This is where you normally start when you register as a patient. First you come and look through this chart, where you test your vision. How far can you see? This is what we call visual acuity.
Early detection is key when it comes to vision problems. Many conditions, like glaucoma, show no symptoms until significant damage has been done. That's why regular eye exams are essential for preserving sight.
We are doing a comprehensive eye screening. This entails, we ask the patient the history, what is the eye issue, and then we do a comprehensive eye examination and we make the diagnosis or know the condition of the patient. For patients who needs medication, we give them medication. For patients who needs reading glasses, we give them reading glasses. And at the same time, we are also doing cataract surgeries.
Cataracts are one of the leading causes of vision loss worldwide, particularly as we age. They develop slowly, often unnoticed, and cloud the lens of the eye, gradually dimming the world around us.
Cataract basically is a lens opacity. Ideally, the lens in the eye is supposed to be very clear, but due to age or some other factors, because of the trauma or injuries or diabetic mellitus, that is the problem with the sugars in the body, they tend to also affect the eyes and makes the lens changes. There are also those who are born with it, we call it congenital cataracts, or they get injury, they develop also traumatic cataract.
Fortunately, cataracts can be treated with surgery, a procedure where the cloudy lens is replaced with a clear artificial one. For millions of people, this simple procedure restores not just sight, but independence and quality of life.
So when patient comes in, they get their anesthesia, specifically for that particular eye that's going to be operated. And once the eyes are numbed, they come in, we do draping for this patient, clean the eye, drape, and then that's they're ready now for the operation. And before the patient comes in, just ensure that the machine is clear for operation. We so far have a line of patients outside there, and one is already in. So we're now preparing, scrubbing, ready to start the surgery. The procedure basically takes around 5 to 10 minutes depending on also that type of cataract. And we start by making an incision in the eye. After the eye is numbed, something called barytony, and then we tunnel. And then once we tunnel, we put some fluid inside just to bring that shape of the inside the space called anterior chamber. So and then we're able now to deliver the lens after doing a hydrodissection, and then we introduce an intraocular lens. So once you remove that old lens, you do an intraocular lens. This is an artificial form of lens that helps now to replace the ones that you have removed. And then from there, we put some injection, that's an antibiotic, and then some eye drops. It's also a form of antibiotics. Then we close the eye and allow the patient to go rest, take some painkillers, and then tomorrow we are going to open the eye. And with any problem, the patient is able to see the following day. Yeah, so the first patient, the surgery is gone successfully, and that is basically what caused that's the procedure for the surgery, the cataract surgery, removing the cataract. And for these other patients, we'll do the same. We'll repeat the same process.
By raising awareness and increasing access to treatment, we can ensure that everyone, everywhere, has a chance to see the world clearly and fully.
This morning, on my way home from work, I heard that there's an eye specialist nearby. I'm happy that I came in and went through the surgery. I really appreciate the doctors for helping us. May they continue helping people, for this is God's plan. She's had this problem for 5 years now. I'm glad that she found help, and her right eye is now okay.
Our sight connects us to the world, to others, and to ourselves. By nurturing our eye health, we ensure that we can continue to see, discover, and cherish the wonders life has to offer. After all, our vision is our most beautiful sense.
Once someone is blind, cannot see, it is a burden because this person needs to be facilitated in every activities that they do. But once you do the cataract surgeries, then this person will be able to do on their own. So that reduces also the burden among the families, and we are happy. It is an honor that we'll be able to do that in partnership with this the great team that have supported us. So we appreciate the partnership, and we hope to do more because we find it is necessary.
The Quantum Awakening Foundation and the Light Foundation would love to thank each and every partner that has been able to partner with us in this first ever medical eye clinic that we've been able to do. And it has been very successful because we have been able to do 150 surgeries and over 1,500 eye screening. So we would love to thank the Lion Sight First Eye Hospital for coming in with their doctors, with their expertise, and even to the local community to be able to give them the services that they need. We would also love to thank our partners, the current community SDA Trust. We would love to thank the Minasota Conference. We would love to thank the Vuna team, which is a voice to unentered areas, for the good job that they've been able to do. May God bless you. Bedankt.